Start the recording. Awesome. So I want to call this Board of Health annual meeting and monthly meeting to order. It's Monday, April 12th, 2021 at 4:30. Amy, would you call the roll, please?
Danielle Chenoweth.
Present.
Andy Kornstrom. And Darlene Kleppel.
I'm here.
Great. So first we'll take our annual meeting agenda with an election of the chair and secretary. There's action required. I'd take nominations.
This is always the really awkward time when, everybody wants all these positions and we can't all have them. Darlene, would you entertain or be willing to entertain a motion to be chair?
Oh my goodness, I'm brand new.
You don't have to. I want, if not, I assume it's coming to me, which I'm fully supportive of.
I nominate Andy to be the chair.
I thought that might
I
happen.
second.
Great, how wonderful.
Andy, I hope you'll be more available to the staff than I have been. I've tried, but I think they're going to be happy to have you instead of me. I see laughter.
It's
I have
closer.
tried. If I could, folks, I would be available. Thanks for kicking the chairpersonship to me, Andy, right as we were hitting a pandemic. I really appreciate that.
It was good planning.
I won't forget or forgive you for that one. So we have a motion and a second. Andy accepts, I hear. Any other discussion? If not, if you could, I guess actually we could take election of the chair and secretary together. Do we have any nominations for secretary? Darlene, you feel up to being secretary?
Do I actually need to take minutes of the meeting?
No,
No? Okay, so I need to occasionally sign letters from us or something?
you're kind of deputy in case Andy has a hip replacement.
Oh, I just did that. Okay. Yeah, I can be secretary.
It's easy.
Super. So, so we have a nomination of Darlene as secretary. I'll second that. Any discussion on the motion to have Andy as chair and Darlene as secretary of the CU Board of Public Health? If not, roll call, please.
Danielle Chenoweth.
Yes.
Andy Kornstrom.
Yes.
Darlene Kleppel.
Yes.
Great. So that passes. Next, we have the election of a treasurer. Ron Fields has played our treasurer to date, and I would entertain a motion.
So moved.
So the motion is to retain Ron Fields as our treasurer next year, correct? I would second that. Any discussion? Roll call, please.
Danielle Chenoweth.
Yes.
Andy Kornstrom.
Yes.
Darlene Kleppel.
Yes.
Great. With no further business, the annual meeting is adjourned and we will start our monthly meeting. Cool. So let's call to order with a roll call our monthly meeting agenda.
Danielle Chenoweth.
Yes, present.
Andy Kornstrom.
Present.
Darlene Kleppel.
Here.
Awesome. So we have all three members present. I would entertain a motion to approve the agenda.
So moved.
Second.
Motion and second. Is there any discussion or changes? If not, roll call, please.
Danielle Chenoweth.
Yes.
Andy Kornstrom.
Yes.
Darlene Kleppel.
Yes.
Great, so that passes. Next, we'll take approval of minutes of previous meetings. We have 2 minutes in the packet, 2 sets of minutes. One is for March 8th, 2021 monthly meeting, and the second is for March 31st, 2021 study session. I'd entertain a motion.
So moved.
Our second for
We have
both.
a motion and a second. Any discussion? If not, roll call, please.
Danielle Chenoweth.
Yes.
Andy Kornstrom.
Yes.
Darlene Kleppel.
Yes.
Next, we have public participation. If anyone would like to address the Board of Public Health, this afternoon. If you could raise your hand, or if you're not able to raise your hand, you can speak up. Anyone interested in speaking to the Board of Public Health? Going once, going twice. All right. Seeing no public participation needs, we'll move on to correspondence. Julie, or you can call on your staff as well. Do you have any updates for us?
I don't believe so. Nothing that, no, always, nothing, no.
Okay. Because there's nothing going on in town. No, thank you for keeping us up to date with all the vaccine clinics and options to help to make vaccines available to everyone in our community. So we've been receiving a lot of regular updates from staff on that, and there's been quite a few opportunities to reach out to populations that have not been able to access those. There's no old business, so we'll move on to new business with the treasurer report. Go ahead, Ron.
Yeah, the treasurer's report as of the end of February, showing a cash balance of $4,641,868. Our total fund balance is just under $6 million of $5,967,135, and that represents about 31% of the budgeted expenditures for the year, and that's keeping in guidelines of the 25% of our annual expenses. We ended the eighth month of the fiscal year with a surplus just over $1 million, $1,018,682. Our total revenues through the year are at $10,899,596, and that's just under 1.6 million under the year-to-date budget, and that's due mainly to grants and contracts that are under budget by $1,336,000. Expenditures stayed until, obviously, with the surplus. Expenditures for the first 8 months were at $9,880,914, and that's almost $2.5 million under budget, mainly due to personnel and benefits.
Thanks, Ron. Any questions for our treasurer? Okay. If not, good. Oops. Okay. So I would entertain a motion to put the treasurer's report on file.
So moved.
Second,
We have a motion, a second, and discussion. Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
yes.
Okay, next we have approval of payments to Board of Health appointees to Treasurer Ron Fields in the amount of $630. This is check request 1231, and to Attorney Ruth Wyman in the amount of $899.90. Check request 1234. I'd entertain a motion to approve both of those.
So moved.
Second,
The motion and second. Any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
yes.
Next, we have a review of the monthly credit card statements. I've reviewed and I don't have any questions. Are there others who may have questions? Okay, if not, I'd entertain a motion to put the monthly credit card statement on file.
So moved,
Second.
We have a motion and second, and discussion. Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
yes.
This next item is a discussion item for CUPHD's retail food program and the FDA's voluntary national retail food regulatory program standards.
Okay, I think we're gonna have to push this off. Jim, we know, is out today. Sarah was going to be here. She was in an accident this afternoon.
So I mean, I don't think, Julie, that needs to be pushed out. This is, I mean, I can talk just briefly about this. The packet Jim included, it just basically is sharing with you that both CUPHD and Champaign County Public Health Department do meet the Illinois food
Oh, I'm
code-
sorry. That was the letter. Sorry.
yeah, food code guidance, as well as the FDA's voluntary food program standards, which is, very few agencies meet the national standards in addition to Illinois' guidelines or standards as well. So we have met both of those for years and continue to meet that as well. So I mean, I think that's all he wanted to
Yeah.
share. He did say that there's a lot of work that goes into it every year, and there is staff even after he leaves who is now responsible to make sure that those requirements will be continue to be fulfilled even in his absence.
And those were, I believe I sent those letters out when we got them, that both the CUPHD and the county received that.
In whose absence have I?
Jim Roberts, when he retires,
Oh, I see.
he has already delegated the responsibility of making sure the paperwork and the requirements continue to be done.
Okay. Great. So this is a discussion item only, page 22 to 25. Are there any comments or questions about the memo that Jim provided? Great. I think there's no action on this item. So I next move to number 5, CUPHD received approval of community needs assessment and health plan and compliance with subparts C and D of the certified local health department code. CUPHD is a certified local health department for the time period of February 26th of 2021 to February 25th of 2026. And I believe this is an approval of our needs assessment and health plan. I entertain a motion.
So moved.
Darlene, was that a second? I think you were muted.
You're muted, Darlene.
Okay.
I'll second.
Okay, so we have motion and second. Any discussion?
Yeah, I do. Didn't
Yes,
we already
please.
send this in, Julie, for the
Yes,
state to
I
approve?
was just gonna say that we're just saying that we got the letters back from the state. You guys have already approved it. What didn't happen was I didn't have the county board of health approve it when they did it. So,
Okay.
I mean, it's already been done. It's already been sent in. It's already been approved where everything's good to go, but we didn't get that on the county board of health one. But
Yeah,
yes,
so it's approval after the fact. I signed it
yeah. And
last
we
week.
have, yeah, you just guys had to have a letter with it. And of course you were all on the committee to put the thing together, which seems like 100 years ago, but it wasn't, it was last year. So anyway, the letters came and the certificates came, and after about 7 times of back and forth with them to get our names correct, they finally did. And we have the certificates now and that. This is not accreditation, but that has all been turned in for reaccreditation, and we should hear back within the month, you think, always? Maybe?
Yeah, there's going to be a site visit in about a month.
So that's the national accreditation thing. So that's on top of that.
Great. So we have a motion and a second, and then further discussion. If not, roll calls in order.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
That motion passes. Next, we have number 6, approval of intergovernmental agreement between the Board of Trustees of the University of Illinois Carle College of Medicine and CUPHD. This is pages 28 to 31.
So
I'd
moved.
entertain a motion before discussion.
So moved.
Second.
We have a motion and a second. Any discussion? I'd love to a brief summary on this topic since it seems to be, groundbreaking. Unless, it seems to be a new initiative. Is that correct?
Yeah, this is basically the Carle Illinois College of Medicine students wanting to work with us through the vaccination clinics that we have in the community. And so we had to have an agreement in place defining what the roles and responsibilities will be.
Fantastic. So that helps to build our capacity to do vaccinations in the community.
That's correct.
Great. Any other discussion? If not, a roll call is in order.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Passes. Next, we have approval of quote from Service 51 for HIV/STD prevention digital campaign in the amount of $20,000. And I think actually we could take these omnibus. Second, we do approval of quote from Service 51 for PrEP digital campaign in the amount of $25,000. The third would be approval of the CAVO Care Service Level Agreement and 2021 Nomad renewal in the amount of $1,818. I would entertain an omnibus motion.
So moved.
Second.
Motion and a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Next, we have approval of PPE invoice from Carlton, Illinois College of Medicine for face shield kits in the amount of $19,320.
So
I'd
moved.
entertain a motion.
Second.
Motion and a second. Is there discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Next, we have approval of amendment to the sublease agreement between CUPHD and Krantz, Inc. I'd entertain a motion.
So
So
moved.
moved. Second.
We have a motion and a second. Any discussion? If not, roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Great. And then, yeah, the next four, which are approval of quotes and purchases, we take an omnibus approval of quote from Zobrio for Financial Edge NXT for user annual subscription of $16,380 per year with a 3-year commitment for a total amount of $49,140. Next, we have approval of purchase order payable to McKeeson for injectable naloxone for residents in the amount of $49,955.04. Then we have approval of purchase order payable to Narcan Direct for nasal Narcan for first responders and residents in the amount of $129,600. And then the last in this omnibus motion is approval of payment to Tiger Connect Inc. in the amount of $7,520 and Tiger Touch for use agreement for client communication technology. I'd entertain a motion.
So moved.
Second.
A motion and a second. Is there any discussion or questions? If not, a roll call is in order.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
That passes. And Julie, it's brought to my attention, did I miss 7? Approval of UIC student placement. Is that what you're saying?
Yeah, I think you did. I think you guys did approval of intergovernmental agreement between the Board of Trustees and University of Illinois College of Medicine, but not the approval of agreement for UIC student placement in
shoot.
a practice setting.
Okay.
Yeah.
We did number 8 though, correct?
I don't think we did.
Okay, because I'm looking at these two and I'm like, uh-oh, I think I switched because I saw University of Illinois and I went
Oh,
down
yeah.
to number 9.
Yes, also that one. There's 3 U of I ones.
Yeah, I think I missed it because of the U of I. So let's do just excuse the interruption, but if we could jump back to number 7. I'd entertain a motion for approval of agreement of the UIC student placement in a practice setting.
So moved.
Second.
We have a motion, a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
And next we have number 8, also was skipped earlier, ratification of an intergovernmental agreement between CUPHD and the Board of Trustees of the University of Illinois for mutual preparedness and response activities, including but not limited to the COVID-19 pandemic. And those are pages 37 to 45. I'd entertain a motion to ratify this IGA.
So moved.
Second.
Motion and a second. Is there any discussion? If not, roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Okay, and next from Mandy, I think we actually approved number 17, Mandy.
You did,
Um,
but she told me that she wants it on hold.
Okay, so let's see. So I would like a motion to reconsider. Is that correct? Approval of payment to Tiger Connect Inc. in the amount of $7,520 and Tiger Touch for use agreement for client communication technology. That's number 17 on our agenda, pages 60 to 66. Let's see, I think that, correct me if I'm wrong, but I believe the proper parliamentary procedure is a resolution to reconsider. It's not that we want to vote it down, it's that we want to table it, correct? So after approving that payment, we could reconsider. Is there a motion to reconsider and then a motion to table?
I'll make a motion to reconsider if that's appropriate.
Okay. Ruth, stop us if we're doing this wrong, but this is what I remember from my parliamentary procedure training. Okay, we have a motion to reconsider. Do I have a second?
A second.
Okay, could we have a roll call and motion to reconsider?
Danielle Chenoweth,
Yes,
Andy Cornstrom,
Yes,
Darlene Klippel.
Yes.
great. So then I make a motion to table approval of the same payment to Tiger Connect.
second.
We have a motion and a second to table. Any discussion? Roll call, please, to table this item.
Danielle Chenoweth,
Yes,
Andy Cornstrom,
Yes,
Darlene Klippel.
Yes.
okay, great. This is the danger of omnibus motions, and we'll just get ahead of where staff is located. Trying to go not too fast, but not too slow.
Wait a minute, I just want to make sure that okay, I've just got to step in here now because
Yes.
I've got to make sure we're putting the right thing on hold.
Yeah,
Mandy says, Danielle, Deb told me she wants to put 17 on hold.
Yeah. And 17 is the item that we just,
Deb who?
It's a program that they're looking at for connectivity with customers, but that's all she could tell me.
Okay. This isn't, Val, I see you're on here. Isn't this your?
Yep, I don't really know why.
Deb, are you talking about Deb Fruitt?
Yes,
Deb
she was just
Fruitt,
in my
you're on
office
here.
like right before the meeting started.
Okay, Deb,
Yes,
what do you have to do with Tiger
Well,
Connect?
well, there's a segment of that Dr. Kara would like to continue to look at. It's part of-
But we don't have to wait for that to make this purchase.
That's fine. We're just
Yeah,
saying, we're
that's-
not,
I'm
sure.
sorry, guys. I think we need to, this is confusing. Okay. Oasis, is there any reason that we can't go ahead and do this tonight?
And I think we can go ahead and make the approval right now. There were
Because it's
some
going to be used in
concerns.
MCH, not necessarily dental. It could be used in dental. It does not have to be used in dental.
It'll be used agency-wide.
Okay, sorry.
Fine.
This is so awkward when we have all these little squares and everything trying to do okay. So
Thanks for
I'm
that
sorry.
clarification.
Can we
okay.
now, how do you double back, take that back, Danielle?
Okay, Ruth,
Ruth,
this
what's
is
the
what you-
process for that
this is
one?
what you get paid the big dollars for, Ruth.
We do, we do want this approved. Dental may not use it, but it will be used. It's a way to contact clients and Oasis. The IT issues were cleared up with this, correct? And everything's good to go.
Yes.
All right, so we do want that. I am so sorry. That's why I was looking, I was trying to figure out Deb who, like, how was that? Okay,
Sorry, I should have allowed for a staff comment on it. I was just taking Mandy's.
nope, that's okay.
statement in
Sorry,
case
sorry
value.
about that. Okay, so let's just go ahead and double back and approve that again.
Okay, so we tabled it for approximately 1.5 minutes.
I move
Go
we put
ahead,
it back on, I move we put it back on the table.
second.
Thanks, Darlene. We have a motion to put approval of payment to Tiger and Connect in the amount of $75.20 and Tiger Touch use agreement for client communication technology back on the table. Any discussion to put it back on the table? If not, roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes,
Darlene Klippel.
Yes.
Okay, now I'd entertain a motion to actually approve it.
so moved.
Second.
We have a motion and a second. Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Great. Phew. That was the hardest approval of $7,000 I've ever had to. Okay, next we have approval of check requests or requisitions. And there are 6 of them. One is payable to Rogards for vaccine clinic wipes in the amount of $8,396. We have payable to McKeeson for vaccine clinic hand sanitizer in the amount of $9,576. We have a payable to the United Way of Champaign County as subrecipient for COVID-19 response in the amount of $85,000. We have payable to Adapt Pharma for nasal Narcan outreach in the amount of $5,400. We have payable to, I think actually I need to recuse myself. So I'll pull that. I won't have that part of the motion. And then, so lastly, if we jump to F, I have payable to Vasquez Construction Inc. for basement remodel in the amount of $73,473. I would entertain a motion to move those A, B, C, D, and F payables.
So
So
moved.
moved.
Second.
Motion and a second. Any discussion? Okay, roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Okay. So next is 18E, and for the purposes of recusing myself from discussion and vote, although I can answer questions as supervisor of township, I will pass facilitation over to Andy Cornstrom.
I would entertain a motion to approve a check to Cunningham Township as a subrecipient for the COVID-19 response in the amount of $25,000. Check request number 1126.
So moved.
I will second that. Any discussion, Darlene?
No.
All right, all those in, I'm sorry, roll call.
Danielle Chenoweth,
I abstain due to a potential conflict of interest.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Can I-
What's that?
Can I just say something?
Yeah, sure.
So I don't, any member can recuse themselves at any time and do not need to give a reason for that, I believe. I don't believe, at least from viewing this, that there's any conflict with Danielle voting on this. I know you chose not to, and that's fine. You don't have to. But I think that even if there's funds that go from the public health district to one of the townships or to the county, I think the members of the CU Public Health District Board, as I look at it, and as I see it, could still vote. I don't believe that there's a financial or pecuniary interest in it because your salaries are set by your town boards and not based on any income coming in from public health district. So just so you keep that in mind in the future, if there are specific questions for any additional votes in the future, don't hesitate to let me know and I can look at that. But just so other board members understand as well, but certainly you always have the right to recuse yourself.
Thanks, Ruth. Yeah, you had sent me that information prior when we were first discussing this. Public health reached out to the townships to ask us to basically pass through funds. So 100% of the funds have been going directly to pay off rental arrears and utility assistance. I don't think any funds are going for admin or staff or anything in those cases. But, you know, I want to avoid appearance of conflict of interest was probably what I should have said instead of potential, the appearance of a conflict of interest. That said, we have, you know, we've spent all the dollars and it's truly appreciated because we are able to support people who don't have income who are COVID impacted, and we're really stuck in between 2 programs. There was a gap in program provision locally. So those dollars are really important and appreciated.
I do appreciate that though, Danielle. I do think it's a good idea that we avoid the appearance of conflict sometimes. So thank you for that.
Absolutely.
Yeah.
Yeah, no, I would say I'm extra cautious on those items just because it's, you know, it's hard for, as a member of the public to actually understand how the monies are being used, and it can appear one way when it's not. Let's see. So we have pending grant contracts to sign. I did have this up a second ago. Are there any pending grants to sign?
No.
Okay, I didn't see any of that. Yeah, okay. So no pending grants to sign. Our next meeting is a study session, April 28th, 2021 at 10:30 a.m. Are we anticipating that meeting?
I don't know that we will need it. I don't, right now we don't, but
Okay,
keep it on we can keep it on the thing and then we'll cancel it about a week out if we don't need it.
okay. And then the next monthly board meeting is scheduled for May 20th, 2021 at 4:30 p.m.
May 10th,
May 10th.
Oh, what did I say?
20th.
Okay. Yeah, I will, you'd think I just had a weekend, but it's been a full weekend. Let's just put it that way. Our next monthly board meeting, May 10th, 2021 at 4:30. Be here, be square. I would entertain a motion for adjournment.
So moved.
Second,
We have a motion and a second. Roll call, please, to adjourn.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
yes.
Great. Thank you, Andy,
Thank
for
you.
taking the torch of chairpersonship.
So excited.
You can go bug him now to sign your documents.
Yeah.
You can carry that torch right over to Nalbo and wave it around.
I think he's a little closer by hanging out at the fire station in
Well, see,
Champaign.
that's what you get for winning the election, Andy.
I know. I could have been done with all this, but here I am. I'm excited, and we're very fortunate to have our Board of Health. There's no doubt. So
Absolutely. Yeah,
Thank you all.
we appreciate the public health staff and all that you have done to make vaccines available. And the data around cases, per capita deaths in Champaign County compared to other counties is astounding. It makes me very sad for those counties. Makes me very proud and safe to live in this county. We've really weathered it thanks to some great leadership and cooperation amongst agencies. So thank you, Julie, and thanks to your staff.
I got to hug my parents for the first time in more than a year last night, so I appreciate it.
Oh, yeah.
Get vaxxed, get together.
Yeah, my mom is staying with me finally, which is great. I'm
Nice.
so grateful.
It's luckily we are still having more demand than supply, so that's a good thing. We're keeping, we're going to do about 5,000 this week in our county, and then possibly more because we're constantly out there trying to scrape it in from other counties who can't use it. So I would rather they use theirs and we use ours, but well, if they're not going to use it, we're going to be right there to snatch it up. So
Any idea when kids 12 to 16 can start taking their vax?
I would not be surprised if it is, they've already, Pfizer has applied for the emergency use authorization. I wouldn't be surprised if it's by the end of the month or the beginning of May.
That'll be my daughter's 12th birthday, so that would be
That'll be
wonderful.
a lovely present for her. That's a good present. Very good. All right.
Oh, great. Thank you.
Thank
Have a good evening, everyone. Thanks, members of the public, for joining us.
Thank you.